Hi, I'm Dr. Tammy Penhollow with Precision Regenerative Medicine. We're talking about the most common causes of knee pain, and there's so many different ways to look at this, but I find that it's really easier to understand if you look at it from the inside out. So let's talk about the deepest structure. That would be the bones and the cartilage. When you talk about the bones and the cartilage, the most common cause of knee pain would be arthritis. And of the types of arthritis, the most common cause is osteoarthritis. It's typically a process in the middle to older age, and it comes with repetitive wear and tear, wear and tear. If we start to get wear and tear, then the cartilage, which covers the bone, wears down. Then imagine if we remove this cartilage level, then there is more of that. The joint space is narrowed, there's not as much cushioning, and you can get pain from the quote unquote bone on bone. Similarly, you can have rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease, and it's an inflammatory condition. Not likely to first get your diagnosis of rheumatoid arthritis because you have knee pain. Most people are diagnosed and they have other signs or other joints that can be involved first. And this can occur in younger populations. A third type of arthritis is gouty arthritis, and that can actually occur at the knee. It's more common in places like the big toe, but it can manifest in the knee as an arthritis. If we move a little bit further up, there could be a fracture or a break in the bone that could come from trauma that can cause knee pain. You know, you did something like you skied down the hill and you crashed into a tree and you broke your leg. So there's obviously a reason to have that. But it can also then create post-trauma arthritis or post-inflammation arthritis. You, at the same time of crashing into that tree, also tore some ligaments or the meniscus and had a surgery to repair those or take out part of the meniscus. Then we know that we've taken out this, so it's going to put the blue on the blue or the cartilage on the cartilage, and years down the road you're going to have more likely chance of arthritis because you've had your meniscus removed. So this is deepest. Very, very rare, but also kind of at a deep level because the bones and the cartilage are served by blood vessels. You can have cancer, or you could have cancer in the bone. So infections or cancer at the deep, deep level, very rare, but I did want to mention it for completeness. If we move just outside to the cartilage and the bone, we have some stabilizing ligaments and the meniscus. We have inside and outside medial and lateral meniscus. We have ligaments that go from the front to the back, that go from the back to the front, that come from the sides and connect the upper bones with the lower bones. And we also have a big tendon here that connects the low bone to the high bone. It's called the patellar tendon. So we can get pain in the knee from problems at these portions. That could be from wear and tear. It could be from a trauma. You were clipped in a football injury and that caused rupture or just inflammation or a sprain. And you could have overuse injury where you start to get wear and tear from the jumping. This is actually called jumper's knee at the patellar tendinopathy. So you can get repetitive or traumatic injuries at the stabilizing ligaments or meniscus of the knee. That's another cause. If we move just outside to that, let's talk about the things that attach the muscles to the areas around the knee. For example, we have the quadriceps muscles on the front. We have the hamstrings muscles on the back, and they attach at points near the knee. We also have the muscles coming up from the calf or from the shin area that attach around the knee. If those tendons have some overuse injury, wear and tear, or maybe some mechanics injuries. For example, you are a flat-footed runner and you just picked up a running program and now you're starting to have pain at that outside of your knee in the outside lower portion, then that could be a result of poor mechanics, or we need to change some shoes. We need to make sure that we stabilize and neutralize muscles if there's muscle imbalance. Stepping outside to that from the tendons are the muscles themselves. Imagine if you tore your hamstring muscle and it was at that portion around the knee where it was inserting there, then you can have knee pain. Or if you strained or bruised your quad muscle, then you can have radiation of pain down into the knee. The other thing was we come just outside of that on the outside band is the IT band, the iliotibial band, and that's on the very outside. Imagine if there's been wear and tear there, it's really tight IT band, and you can get pain at the knee, particularly on the outside of the knee. So that's a way to look at knee pain causes from the inside out. To diagnose them, you'd need a good history. Did you just start an exercise program? Was there a trauma? Was there a fall? Was there something specific? Or did it just happen out of nowhere? Did you feel a pop, a pull, a strain? We put that together with a physical examination, and we're likely to get some images. In the office, we'll do an ultrasound, and that'll allow us to see a lot of these soft tissue things, the outside things, but we can't really see the good parts of the inside, so we may send you for x-rays. So we've talked about the x-rays will help us see if there's a lot of joint space or not a lot of joint space. If we have fractures, to actually see the bones. Sometimes for even more in-depth of the soft tissues, we need to get an MRI or a CT scan. So all of this comes with a history, a good physical examination, and some extra tests that can be from radiology, for example, the x-rays or the advanced studies, or even drawing your blood so we can see if you've got these inflammatory markers. Do you have the rheumatoid factor? Do you have other elevated markers of inflammation? That's how we get to the bottom of why you're having knee pain. If you're interested in our knee boost program, please reach out. Thank you. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.